guest is Dr. Greg D'Angelo, who's with Bluegrass Orthopaedics, who is an orthopedic surgeon who does robotic surgeries for osteoarthritis of the knee. Welcome.
Thank you very much, Dr. Fox. Pleasure to be here.
Well, tell me a little bit about osteoarthritis. What is it? What causes it?
Well, osteoarthritis is an extremely common condition. Approximately about half of all the people in the United States will have osteoarthritis at some time in their life, and it's a common disease that's been around since the dinosaurs. And basically what happens in osteoarthritis is the cartilage goes through a degenerative process. It starts off with some softening, and then it'll start to crack, and then it'll start to fall apart, and it'll literally fall off the ends of the bones. And when it does that, it becomes very painful. And when that occurs, it'll also cause some swelling and can cause locking, popping, and a lot of pain and stiffness. And once you start getting those types of symptoms, you usually seek treatment.
Now, you talked about bad symptoms. I mean, there's ranges. There's mild arthritis, which a lot of people have, to very severe, different stages.
Absolutely, and that's a good point, because arthritis can exist without symptoms, and you do not necessarily have to seek treatment. It's when it starts to cause symptoms that cause the stiffness and the pain and the interference with your daily activities that you start to seek treatment, which can be anything from medications up to surgery.
So we've got some x-rays with early stage, mid stage, and late stage disease.
Yeah. That x-ray on the left is a normal knee. The x-ray in the middle is one where the cartilage has started to wear away from the inside of the knee, and it's important that that x-ray be taken standing. And then finally, that x-ray on the right shows the whole knee is involved with osteoarthritis. There's no cartilage left. There's deformity and shifting of the bones. And we see a very obvious progression there. And what we're going to talk about today with the robot is what you can do when you're in that mid-range stage.
Well, tell me about that. You mentioned the robot. When I was training, all they did was total knees, but now it's a little bit more sophisticated.
Yes. The principle of this is, if only one part of the knee is bad, just replace that part. We have techniques with radiographs and special evaluations to determine whether you need a partial or a total knee. And if you need a partial, we can now replace it using this robot that you see here. I can actually replace that knee on the computer in the operating room, making sure that all the parts fit, that the parts contact each other properly, that the balance is right. And when it's all just right, that tool there will actually tell me where to cut the bone precisely, where the component will fit, and give me all those features that I need with balance, range of motion, stability. And the nice thing is, too, is since it's so minimally invasive, I can do this through a 3-inch incision.
Now, you mentioned a 3-inch incision. That's better than a big foot incision to put the whole knee in. So tell us what's the difference between, doing a total knee and doing a robotic knee in recovery time.
Well, obviously with a partial knee, you just have that one portion there that you can see being replaced, and that it causes a lot less pain. There's a lot less cutting that has to be done, so there's less bleeding. Rehab's a lot easier, and you can actually have this done and go home the same day.
Well, that's great. What's the risk of doing a knee surgery?
Well, all knee surgeries carry a risk of blood clots, and that is the one that we always try and prevent or minimize, and that would be deep vein thrombosis. There's always risks of bleeding and infection, stiffness, incomplete relief of pain, but these are all relatively minor complications, and the vast majority of patients who have their knee replaced are very happy with it.
All right. So before you get to the surgery, which is the ultimate fix, so to speak, there's some other things you can do first.
Right. Just because you have arthritis does not mean that you have to have treatment. There is no cure for arthritis. You can always reduce the symptoms, and you do that mostly with medication. Anti-inflammatories, classics are naproxen or Aleve, ibuprofen. There are others like Celebrex, and then you can have arthritis such as rheumatoid or gout, and there's special medications for that. The other important thing to do is modify activity. If certain things hurt and you can get away without doing them, don't do it. If you can keep your weight down, that'll help unload the joint. Maintain good range of motion. You don't have to go out and walk and stress the joint, but if you can keep that knee moving every day, it's very helpful.
could also inject the joints, and you can do that right there in your office.
We can do joint injections. They're just a temporary fix, so to speak. They will not necessarily cure the disease, but they can knock the symptoms down, and if it delays surgery or other more invasive procedures, then it's a good idea.
Well, that's great information. Great information, Dr. Greg D'Angelo with Bluegrass Orthopaedics.